The bird flu is in overdrive, or the flu is in overdrive. They're also talking about the bird flu, and it literally seems to be almost everywhere. Check this out. If you live in like Montana or Wyoming, you're in the clear. But the rest of us, when it comes to the flu, not so much. NBC medical contributor Dr. Kavita Patel joins us now. Dr. Patel, that was a lot of red on that chart. I got my flu shot last week because I'm a procrastinator, but now I'm like freaking out every time my daughter coughs. Is it too late for those of us that waited too long?
No, it is not too late. Gadi, you're in good company. Everyone around me is having some symptoms. It's hard to know what it is right now, but it's not too late to get the flu shot. In fact, we think this flu season could extend even into the April and May months. So not too late, one shot and just get it done. And the immunity, even though it kicks in about 2 weeks after you get the shot, there's still immunity that you get even in the immediate days after the shot.
Yeah, I'll take that immunity. And cold versus flu, like, remind us again what the difference of those symptoms is, because it all just seems like the flu.
It does. It does. And a lot of people describe it like I have the flu, but often the technical actual flu has a lot more kind of sudden onset and more severe symptoms than the cold. So flu often includes a high fever, body aches. If you feel like you had a workout, but you didn't work out, that's probably the flu. Colds have a little bit less of that and more of like the runny, stuffy nose, sore throat with some mild fatigue. So those are kind of the key differences between the two. But often I've seen people who swear they've got just a cold and it turns out they're flu positive. So getting checked can be helpful just to make sure you know, and especially if you're high risk, because we can do antivirals.
I'm the opposite of your patients. I usually have a cold and I'm like, no, this is definitely the flu. I'm like dying. This is very acute. One other thing that we want to talk about, the CDC seems to be sounding the alarm about the bird flu. Like what is going on there?
Yeah, we're seeing an uptick in bird flu in animals, including in dairy cows. So this is just in general, we know there's just more bird flu circulating. I just want to temper set. We have had no human-to-human transmission. We also have had, in almost all of the cases, we can say that they had exposure to some of these animals. So I think the key here, Gadi, is just if you handle, or even in your backyard, if you have animals that seem sick, be very careful. Do not handle them. Call the public health service. And if you, of course, have any symptoms, we should be checking to see, and you can do a quick test just to see if it might be the bird flu, not at home, but in a doctor's office and in hospitals.
Yeah, always good advice, no matter what season it is. Dr. Kavita Patel, thanks so much. Great seeing you.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.